Broward Health has had the distinct pleasure and honor of introducing to the community the Kinship Cares Initiative. This initiative allows us the ability to work with our partners in the community to represent and coordinate services for families who are in kinship relationships. These are children who are in relationships with other relatives that are not their birth parents. However, they may be grandparents, aunts and uncles, neighbors, good friends who have taken on the responsibility of caring for children that are not their birth children. So the Kinship Cares Initiative allows us the opportunity to coordinate social services and other resources, medical care, to these families.
As the Chief Operating Officer at Broward Health, I often get grants or programs on my desk that I look at. I was there as an advocate for this program, as someone who'd lived in the same shoes as many of the parents, aunts, uncles, folks that we'd be touching. So it was much different for me in terms of the level of commitment, because I was a foster parent. I knew how we could so positively impact the people who are dealing with this vulnerable group of children that we're talking about. Upon volunteering at this shelter, had met a young child, James, who ultimately became my foster child and subsequently became my adoptive child. 2 years after James came to live with me, I found out, I got a call from the shelter that he had a sister that had just been born, who at the time she came with me was 5 days old, and again became even more aware. Now I'm dealing with a baby and a sibling group. I got another call from the shelter. There's a 2-year-old sister, the sibling of both James and Sarah, who had been lost in the system. And she had now was at the shelter, and they were looking for a placement for her. And again, I raised my hand and said, I must take that child into my household. Just again, I could not bear the thought of that child not being with her siblings, her brother and her sisters. And to be able to have a program that says, okay, you can come see us, and it's a one-stop shop. Come see us, we're going to take care of whatever needs you happen to be. Healthcare being a big part of it, and something that that is important, but want to make sure that that's not the only part of what we do here in the Kinship Care program.
It's my pleasure to introduce you to 2 families that I'm aware of that we've had contact with for over the past 2 years. One of them is a Brown family, and the other is a Lewis family. The Brown family is a very special family in that this grandmother became the caregiver for her 2 grandchildren who resided in another country. Because their parents died within months of each other, she had to relocate those children from the Bahamas to her home here in Fort Lauderdale.
I got involved with the Kinship Care Initiative when I first started working with Javon Brown as his big brother in the Big Brothers Big Sisters program in Broward County. One of the great things about the Kinship Care program is that there are folks on the staff that are a great help to the family and to me as well, to try to navigate through all of the different pathways that you've got to go through in the healthcare system.
Scott is my right hand. I don't know. I said, this is one good thing the Lord has done for me, to send him in our lives. You know, he did so much for us, and I'm so grateful. It saved us a lot of money, because if we had to come up with that amount of money, we wouldn't have it. They wouldn't have gotten the treatment. It does us a lot of good.
I was going into my 8th grade year, and I needed a uniform, and I had absolutely no clothes. And the Kinship Care program, they helped us with that. Like, they came one day and just loaded us with clothes and shoes.
But I knew when we met this family that we had to intervene, that we had to help, that we had to give, and that's what we're doing. Through the navigation service of our nurse navigator, we schedule the appointments, we go to the appointments with them, we schedule follow-up appointments, we consult with the doctor, make sure that the family understands the treatment plan. We go over it with them time and time again.
The Kinship Care program, it's very supportive to my family. I mean, it's supportive to my grandmother, me, and my brother. The first time I met Miss Phyllis from the Kinship Care program, I had a doctor's appointment. I don't think I knew she was going to be there, but she came kind of like a good surprise, and I seen her. She's kind of like a good fairy.
We know that without the Kinship Cares program, a lot of healthcare needs will go unaddressed. This is why we do what we do. We love these people.
You know, if I need help, what can I do?
You call me.
I have to agree with your system and do what you want me to do.
We won't let you down.
I hope not.
We won't.
Another case that's very special in mine is the Lewis family. Leanne Lewis, a young woman herself with aspirations of being a nurse, found out that she had to become the caregiver of her younger sister.
Yeah, I've had to grow up really fast. My father was arrested for domestic violence. I was in college at the time. My sister was a part of the situation. I've had to take care of her legally. I'm 21 and my sister is 16.
I go to Deerfield Beach High School. I'm in the 9th grade, and the program has helped out a lot.
My job basically is to go into families' homes, do an assessment on their needs as far as medically, socially, and I came across their file, and reading about them was just amazing, and to finally come out and meet them was even more amazing. I just want to help them in any way that I can. Their mother had passed and they're very young, and you know, she's in college and she's in high school, and these two girls are basically raising themselves and trying to figure out this whole life thing, you know, on their own without the guidance of a parent. That's what really touched my heart with them.
Kinship Care program got in contact with us from Kids in Distress, and they've helped us out with finding a doctor, getting the dental exam, and also helping with the physical, and also just the Medicaid process. What I like most that they've helped me with is counseling. I feel that that has been the true key to helping me and my sister getting through the situation that we're going through. Just sitting down and talking with the counselor and letting her know just how we're feeling and what's going on with our situation, it's helped us out a lot.
And who wouldn't want to help them? This is why we do what we do, because of people like Deanne and Leanne, and we'll go through great heights to make sure that they are successful, even beyond the kinship program.
Thank you for helping us. Thanks to our partners. We love our kinship families. And this, we believe, is one of the best community benefits that Broward Health can offer. Because our kinship families, we all care. Thank you.